Once loved by so many to enhance their looks and defy facial aging, nowadays, filler has gotten itself a bad reputation. There's so much negative buzz on social media surrounding filler, and internal industry stats show that dermal filler sales have gone down. We've been bombarded with pillow faces and sausage lips on television and in real life, and as more and more celebrities and influencers flock to have their fillers dissolved, it leaves so many wondering, should I get fillers? Will fillers eventually migrate and make me look weird? I recently had an older video surge, and in the video, I spoke about liquid facelifts and tweakments that can be done with fillers. And I got a lot of questions, concerns, and it was just one negative comment after the other negative comment about filler. So I hear you, and I want to address all of your concerns and answer all the questions you have, such as, will filler make me look unnatural? Do fillers eventually migrate? Will fillers eventually make me look fake? After a certain age, should I stop using fillers? Why do so many people who get fillers look weird? And I'm gonna tell you my secret on how I keep my patients looking 100% natural. So let's set the record straight about fillers. In 2021, 1.8 million people in the US received dermal fillers. I don't have this year's stats because it takes the companies a while to gather data, but take a look at these people. Can you spot that they have filler? One of the biggest misconceptions about filler is that you're able to spot every person who has it. You have to realize that you're only able to spot the people who look unnatural. This was an Allergan commercial that advertises their line of fillers, and trust me, they would make sure that all the models treated in this commercial look natural looking. Otherwise, it could give their fillers a bad name because people would associate the unnatural look with their line of fillers. But it doesn't matter what filler brand you use, all of them can give you unnatural looking results in the hands of a provider who goes beyond your natural facial contours or anatomy. What's happening is people equate those they can recognize who have obviously looking filler to everyone who has filler. Also realize when you see people who look unnatural, you don't know what they had injected. Priscilla Presley and other Hollywood A-listers were victims of having industrial low-grade silicone, similar to what's used to lubricate auto parts, injected into their face by a doctor who wasn't even licensed in the US. It could also be facial fat transfer, which can look unnatural. It could be cement. You don't know if it was a black market product they had put in their face. There is a black market for filler, and even though it's dangerous and illegal to sell hyaluronic acid fillers online, despite the risks, consumers remain undeterred, with many going as far as to inject themselves. I cannot tell you the amount of messages I get from people emailing me or DMing me on Instagram asking if I want to buy cheaper products from them instead of buying from the companies that actually manufacture the filler. This is why we can't blame filler for every botched looking person. You cannot spot a person who has fillers if their fillers look natural. So, what causes someone to look botched? When a lot of filler is placed into the skin tissue, it can give it a firmer appearance than their skin naturally has. And the most common areas you tend to see this are the lips and cheeks. In general, you can put 3 to 4 or more syringes of filler in someone's cheeks and it look completely natural because cheeks are the largest facial unit, so they can take a lot of volume. But things start to look weird when you put so much as to go beyond the person's natural cheek contour, to which you're giving the cheek more convexity and more anterior projection than it naturally had, which you can see with Simon Cowell. His cheeks did not have this anterior projection, and you can see his skin looks more firm. And this is because of too much filler, which he admitted to going too far with. You can treat other areas of the face, like the chin and jawline, with a lot of filler, and it won't be obvious because in this case, you're mimicking bone in these areas. In this patient, we did around 3 syringes to her chin and 2 to her jawline for a total of 5 syringes. But when I'm treating these areas, I usually don't do more than 2 syringes at once per area. So let's say 2 syringes to the chin and 2 or 3 to the jawline because I want to allow for adequate tissue integration. On the contrary, the lips do not take a lot of filler to make someone look unnatural. It's a very low threshold before you can tell that a person's lips have filler in them. And that's because lips are a very unique anatomical area. They're tubular structures bound by distinct borders, so it's obvious when they're over-injected, and I've spoken about this in other videos. What also comes into play? People get filler blindness, and this is a very common thing that happens in the lips where they don't perceive how full their lips are anymore. And it commonly happens after a few treatments. Courtney Cox revealed that her dissatisfaction with fillers occurred gradually over time after doctors continually told her that a little injection here or filler there would help. Next thing you know, you are layered and layered and layered. You have no idea because it's gradual until you go, oh, this doesn't look right. Another factor that comes into play, injectors themselves don't look natural. When I go to cosmetic conferences, I'd say around 25 to 30% of the providers there look like they've had work done to the two most common areas that we mentioned, the lips and cheeks. So if cosmetic providers have lost sense of what a natural looking face looks like, then you can see how this could lead to patients looking unnatural. Another thing that comes into play is marketing promotions when practices sell packages like the Kylie Jenner package or lips and cheeks promotion, as if everyone needs the same amount of filler. I don't love that idea because you're going against customizing and personalizing treatment to the individual, and you can encourage someone to get more than they may need because they're getting a bargain. How to avoid pillow face. Find the right cosmetic injector, look at their before and afters. Do they look unnatural? Go to somebody who provides natural looking results, and be careful how often you're getting filler retreatments to maintain your results. There's no set time frame that I can tell someone how often they're gonna need to get retreated with filler. You can guesstimate, but you shouldn't necessarily think you need to retreat yourself every 6 to 8 months. Filler can last years, especially under the eyes. This is the area of the face where filler can by far usually last the longest, longer than any other area of the face. You have to be especially careful with how often you're retreating your lips with filler. Find someone who isn't afraid to say no. And if you want to learn more about how often you should get lip filler, make sure you check out this video after. Do all fillers eventually migrate? Filler migration is when fillers move to areas other than their initial intended injection sites. Another common misconception is that all fillers eventually migrate. This is not true. Fillers do not all eventually migrate. Migration can happen, but true filler migration is still one of the least common, least problematic complications from filler. Certain areas of the face are more prone to having issues with migration, and the two most common areas are the lips and under eyes. Why the lips? The lips are the most popular area of the face to treat with filler because it can really enhance someone's look and their sex appeal, which is why it's so addictive, driving people to push their anatomy past its boundaries because they think more is better. This is why migration is most prevalent in the lips. The second most common area is tear troughs. Hyaluronic acid fillers can attract water. They're hydrophilic. And when it comes to the under eye area, this is a very unique anatomical area. The skin is thin, so swelling is obvious, and the lymphatic vessels in this area are fragile and compressible. And sometimes adding filler to the under eyes pulls in water years later and can block lymphatic drainage, which can lead to persistent swelling. I attend aesthetic conferences every year, and this year there were a number of lectures on the issues with under eye filler swelling that can happen years later after injection. Aesthetic providers told story after story of treating patients' under eyes. Everything was fine, and then maybe 8 years later, their under eyes started swelling out of nowhere. And some of these providers were heads of plastic surgery departments at universities, so they obviously were experienced and knowledgeable in treating the patient's under eyes. This is a known issue with filler to the under eyes, and if it happens, it doesn't mean that your provider necessarily did something wrong or injected you with the wrong technique. Whether they use a needle or a cannula, it doesn't matter. It can happen. This is why I've gotten more selective about patients I treat with under eye filler. In general, filler to the tear troughs can last several years, and some people even say it can be permanent. I can attest to that. I have under eye filler, and this swelling years later is not a known issue with other areas of the face. And before you disagree with me, I'm not talking about the hypersensitivity reaction that can happen anywhere you get filler on the face. That's something completely different, which can resolve on its own or with oral steroids. It's not the same thing as migration or this delayed lower eyelid swelling that I'm describing now, which can sometimes happen after getting filler to the under eyes. So if you want to treat your under eyes with filler, just know it can look great for years, and then later you can develop swelling. And if that happens, you can always have it dissolved and start again. That's the great thing about hyaluronic acid filler, is that you can always dissolve it without any damage to your tissues. Guys, if I had this many issues with filler migration, and I think I speak for the cosmetic industry when I say this, no provider wants to have to deal with managing complications that are so high. If I were having that many issues with migration whenever I did filler, I wouldn't offer this treatment, period. I just focus on Botox, biostimulators, and peels. That's why Quo, an FDA-approved cellulite treatment, went off the market because it had around a 10% rate of causing hemosiderin staining, which could last for several months to over a year. It did a good job treating cellulite, but the complications were too high. After a certain age, will I have to stop using fillers because I'll look fake? Yes. And no, let me explain. If someone is keeping on top of facial aging, which is the best way to go about it with non-invasive injectables, as we've discussed in this video, I do think that at a certain point in time, you cannot continue to solely rely on filler to restore the lost volume to every single area of the face. And when I say filler, I mean hyaluronic acid fillers and Radiesse. I believe that it could lead to someone looking unnatural. Why? For the same reason we discussed earlier. When a lot of filler is placed into the skin tissue, it can give the skin a firmer appearance than it naturally has. So if someone were being on top of facial aging, you're gonna eventually benefit from global volume restoration because the face ages everywhere. And ideally, you wanna come in before all your results are gone. And in this case, you can accumulate a lot of filler into the tissue and it could give it a more firm, unnatural appearance. I personally don't like using filler everywhere on the face. I don't like using it to the temples, the lower cheeks, the lateral areas of the face because filler just doesn't spread well in these areas. And although filler can do a great job restoring volume to the temples and it gives immediate results, I personally don't love the way it feels. I had my temples filled with Radiesse several years ago and you can feel it. And I've had other patients who have had filler to their temples say the same thing. They don't love the way that it feels. Now, if someone was using filler for global volume restoration, and let's say they let all their filler dissolve on its own before they got retreatments, then I don't see how that would result in an unnatural looking appearance. But then you're letting all the filler dissolve and you're not staying on top of facial aging if you're letting all your results go away. That's not the best approach to maintaining a youthful look because you're going to see volume loss. You're going to see wrinkling or loss of elasticity to the skin when the filler goes away. Why is there so much negative buzz on social media surrounding filler? Social media is blowing migration out of control, making it seem worse than it is in terms of numbers because trend cycles are speeding up. And we spoke about this on other videos. There's also the negativity effect or negativity bias. Things of a more negative nature have a greater effect on our psychological state. Let's say you got a new outfit and you get a lot of compliments on it, but then one person says it's ugly. Even though you got all these compliments, you just can't help but focus on that one comment that it was ugly. Our minds will give more focus to the negative. So even if you have people who get filler, they're happy with it, no issues, they look natural. Remember, you don't know who got filler if they look natural unless they tell you. Your mind will always be focused on the negative. This is why negativity dominates the news. What's my secret to keeping patients looking 100% natural? I like to use fillers for enhancements. For example, someone wanting a natural lip enhancement, a chin enhancement, a jawline enhancement, because filler enlarges and expands the tissues, allowing facial features and anatomy to go beyond what the person naturally has. But I like biostimulators for anti-aging, or when I need to restore the loss of volume globally to a face. But not in every case. If I wanted to restore someone's lips and the tissue surrounding the lips, I have to use fillers. You can also use filler to the dorsal hands as well. So right now, filler will always have its place. Now, sometimes I like to use fillers for anti-aging if someone's wanting immediate results. And you can use fillers for multiple areas of the face, but for long-term anti-aging, I prefer biostimulators because the results are natural looking because they're stimulating your own collagen. People love filler because the results are immediate, but I think our industry has become more familiar with the limitations of filler. I think that's why thread lifts are appealing, but as mentioned in other videos, I'm not a fan of thread lifts. And this is why I predict the future of aesthetics when it comes to anti-aging will lead more and more toward biostimulators like Sculptra. Internal analytics show that biostimulator sales have increased by 40% within the last year. If you're afraid of getting filler, I understand, and I feel the industry is somewhat at fault because of all the people walking around with unnatural looking results. The patients, the providers, I feel they've given filler a bad name. There is a problem with looking unnatural, and we discussed it in great detail in this video. Comment below and let me know if you've had filler. Are you still afraid of getting filler? And just remember this when deciding who to choose to get filler with. You can get any provider to technically inject you, but to get someone who can artistically do it, who can study your face and appreciate your unique facial features, that's an art, and it requires that they know precisely where to place the filler as well as how much to inject to maintain natural looking results. Don't forget to check these videos out to learn how you can look more naturally beautiful.